Welcome to implant scanning, utilizing scan bodies powered by the iTero Element intraoral scanner. First, fill in the RX with the patient's details and implant procedure information. Now you're ready to start scanning. Make sure that the lighting is set up and that you're in the 12 o'clock position. Scanning in a edentulous area can be challenging as each region has its own difficulties and the ridge can have undercuts. Before starting to scan, it is good to review the anatomy to prepare an efficient scanning strategy. We have provided 3 questions that may help you decide where to start scanning. Is the scan body isolated in a large edentulous area? Are there posterior teeth in the arch? How is the ridge anatomy, thick or thin? In this case, the scan bodies are in an edentulous area with a relatively thick edentulous ridge and no posterior teeth. Let's start from the arch to capture all the edentulous anatomy first. Scanning execution is divided into 2 main steps. Step 1 is the pre-treatment scan. Step 2 captures the anatomy of the arch and the scan bodies. It's important to note that we're going to scan the scan bodies for number 18 and 21 in the second part of this video. Let's start with the pre-treatment scan. The scan has 2 distinctive features. First, numbers 1 and 2 appear on the lower arch, and the background is yellow to indicate that you're looking at the pre-treatment segment. Dry the area with an air syringe. Remove the healing abutment immediately before scanning. This scan collects information about the emergence profile of the implant, which will help the lab to design better customized abutments. Before starting the scan, confirm that the teeth are free of excess saliva and use your fingers to retract the cheek. Once the location of the starting point is confirmed in the viewfinder at the most distal position, turn on the wand and scan the occlusal aspect of the ridge at the lower arch in a single continuous motion. Change the wand orientation to a vertical 45-degree angle to the lingual surface. Move backward at the lingual area to capture the edentulous ridge and the gingiva surrounding the implants in the emergence profile. In the most posterior region, change the wand orientation to horizontal to capture the buccal aspect of the ridge. Keep building the anatomy of the emergence profile for both implant sites. In this case, capturing the anatomy of the contact point is not mandatory, but having that backup information can be useful. Move to the upper arch and proceed to scan in regular sequence. Occlusal. Moving to the palatal and capturing the palatal anatomy of the quadrant and the buccal area. In this case, the patient has an upper denture, so make sure that you capture the anatomy to create the proper occlusal contacts. To complete this first section, scan the bite registration. Confirm the patient's bite before scanning. It is recommended that the patient is sitting in order to take an accurate bite registration. In this case, we scanned a quadrant, so let's take the bite on one side. When using a pre-treatment scanning workflow, it is especially important as it allows you to change segments by tapping on the directional arrows and to avoid adding information in the wrong segment. Let's move on to the second step, capturing the anatomy for the arch and scanning the scan bodies. Place the scan bodies in their positions. Take an X-ray to confirm that the scan body is properly seated. Dry the scan bodies. Ensure that no tissue or saliva is around the union between the gingiva and the scan body. The patient is ready for scanning. Scan the arch with the scan bodies in place. Start with the occlusal and move to the anterior teeth with a lingual inclination. The focus of this segment is the mesial contact point. Turn your wand vertically to follow the ridge anatomy and to also capture the scan bodies from the cuspid back to the posterior region. During this step, make sure you add enough ridge and scan body anatomy. In preparation for scanning each scan body device, I took the time to capture the contact point at the cuspid, twisting the wrist towards the distal portion of the tooth. Finish this section by scanning the buccal aspect from the retromolar area to the anterior teeth of this lower left quadrant. Come back to the contact point area to ensure you have added all the contact anatomy. Once you conclude the prep arch, it is time to scan each device. Rinse and dry the area and keep the cheek separated from the scan body. We're scanning implant site number 18. Center the scan body in the viewfinder with a slight angulation to capture the occlusal and some of the buccal or lingual area. Scan each segment in order, occlusal, lingual, and buccal, for short periods of 5 to 10 seconds per aspect with the wand at a 45-degree angle. Notice that the scan body information is near or around tooth number 18. This area in high resolution is presented in color while the prep arch is translucent. This confirms that you are scanning in the right segment. Repeat the procedure for implant site number 21. It is especially important to show the unique identifier completely scanned. Some implant brands have a collar or undercut. You may miss part of the anatomy, but make sure you completely scan the gingival area and the unique identifiers. Now the scan is complete. Before post-processing, review each segment to look for missing anatomy. Complete scanning any missing anatomy before dismissing the patient. When you finish scanning, click the View mode and review the scans. Post-scanning review is divided into the review of 2 scans, according to the steps. Pre-treatment scan, Scan 1. Scan bodies in the prep arch, Scan 2. When reviewing scan number 1, activate both arches to see the model in occlusion and rotate to target the occlusion points. It helps as a reference to confirm that the patient is biting properly. Make sure you assess the occlusion points in both arches. The first scan for review is the anatomy of the emergence profile for the implants. Make sure to rotate the model to ensure complete capture of this region. When reviewing scan number 2, it is possible that the scan bodies collide with the opposing arch. The final crown will have the proper height. Now let's review each scan body separately. In this image, you see a scan body for tooth number 18. Note the number and tooth prep marked on the diagram on the left. Rotate the model to assess the scan from all surfaces. The arrows show a unique identifier and the gingiva around the scan body free from moisture. You can choose the directional arrow to move to tooth number 21. Rotate the model to assess that all the anatomy has been captured. The arrows show that I captured all necessary anatomy of the region. There are 2 areas where you might have voids that are acceptable. The area at the center of the scan body where the screw is located, and the undercut on the junction between the metal collar and the plastic of the scan body. Scan number 2 provides information on the adjacent teeth and the mesial contact point. Note that once you review the prep arch, it changes to color. Note the arrows pointing to the distal aspect of tooth number 22. The post-scanning review is completed and you are ready to send this case. Tap the envelope to send the case from your iTero Element imaging system. From here, you can go back to re-watch any topic from the menu. It starts with iTero.